Hi class, I'm here with Dr. Evelio Sosa to discuss the stigmas associated with HIV. Hi Dr. Sosa.
Hello, thank you for the opportunity. And first off, I wanted to mention that I've been a psychiatrist practicing in the local community for over 20 years. And I've had the opportunity of working with individuals affected with HIV.
Okay, so my first question is, how has HIV or AIDS affected the lives of patients both professionally and personally?
Well, I think to a certain degree it overlaps the personal and the professional aspects. There's a lot of similarities in issues that they have to deal with. Initially, certainly there's anger related to it, deception. There's a lot of shame and guilt that comes along with this illness. And this carries over to the workforce as well. On the personal side, it's relationship with families, friends, partners, how it affects your social life in general. There's quite a shift at all levels. And when you translate this over to the professional aspect in the workplace, there's a lot of similarities. Also, even possibly considering issues of discrimination, as they feel that they may not be able to get positions that they would otherwise be able to obtain. Many of these individuals feel marginated. They don't feel normal anymore. On occasions, even describe themselves as feeling dirty. The community in general, and this could be not only individuals that are close to the affected individual, but also co-workers that may feel that the reason that they have HIV is because they have brought this upon themselves by being negligent in their care or careless in their behavior. And so they deal with many stigmas, and these are just some of the many that they have to deal with throughout this process.
So my next question is, what are some of the unique mental health challenges affecting patients with HIV?
I would say first and foremost would be depression. Because of what I already mentioned, it becomes a hardship. They feel lonely. They feel as outsiders many a times. They lose close relationships. There's a sense of loss of health, and this can spiral downwards to a depression. So I believe from a mental health standpoint, that would be one of the most important mental health issues. But again, they have to deal with so many other issues that we described. The shame associated with this illness, the guilt that comes along with it. And those are issues that have to be addressed as well. And I don't mean that they just have to deal with these issues on their own. These are issues that need to be identified. Each individual is very unique in their own way, and the way they perceive their illness, and they really cope with it. But many have to engage in psychotherapy to be able to process and cope in the best therapeutic manner with this new diagnosis.
Also, have they had any negative or positive experiences receiving treatment or having their needs met?
I believe that can be seen in two aspects. You mentioned positive and negative aspects of it. So, the positive is that the medication regimens that are utilized today, in comparison to the treatments that were originally offered to patients, are simpler. You may be having to only have one or two medications administered. They're much more effective. Tolerability is always an issue. So that can become negative, a negative side of it when they have to deal with the side effects of these medications. But I think keeping on track with the positive aspect of it is that I do believe that individuals in some way feel empowered by taking the medication, because this is a way of them having control, if one could say that. You don't have no control of this illness, but that you have certain control where by taking the medication you're controlling the body's response to this medication. You boost your immune system, which is what protects you from infections, which unfortunately individuals with HIV are at higher risk for. Opportunistic infections are very common in this population of individuals. The negative part of it is, we mentioned side effects, having to take medications, and also by having to take these medications, it's a constant reminder of their illness, where they find themselves fragile and exposed to in a certain way. And this is this constant reminder that I'm ill, I'm fragile, I'm more at risk for other things or other illnesses to occur. So it's I think that's the best way that I can describe the positive and negative aspects of treatment.
And are there any recommendations you would make to another person who is in the same circumstance?
If this refers to another individual that is also affected by HIV, whether it's first time or some or newly diagnosed, or somebody who's been dealing with this for some time, I don't think it changes much. You would tell them, advise them the same way. I do believe that it's very important initially for them to have an understanding, and more so an acceptance of the illness, and then certainly they would need to understand their illness, and this would lead to better compliance with treatment. So it is important to focus on those issues initially, and then unfortunately then comes the latter part of the stigma of the diagnosis, and who they're going to tell, how they're going to describe this to who they're going to disclose this information to. It's very difficult, because every step they take, it's very difficult. So it becomes important to address with them beforehand some of the feelings they may have, the importance of processing these feelings, again, anywhere from anger to rejection, shame, guilt, feeling marginated, lonely, etc. It's important, and so I think that's what I would keep very constant with these individuals. And by the way, there is something that is a very useful tool for both the patient and the provider, in that it's a Berger's HIV stigma scale. And it's got a long version, a short version. But the questions that are asked there are questions that the individual may not have even thought about, but it brings it to their conscious nature to be, so that how will they address it? What will they do? How do they see themselves perceived by close friends, families, partners, by co-workers, inclusive? So I think that's a very useful tool that will bring out a response from patient. It'll kind of open their eyes, if one could say that, to things that they may be dealing with that they're even unaware of. So that's an extremely useful tool.
And my last question is, how should these issues be addressed by clinicians as well as healthcare systems at large? I believe that everyone in the healthcare field at this point in time
This is an illness that has been around for a long time. People are now, if one could say to a certain degree, a little bit in the healthcare field, much more accepting. They feel much more comfortable treating patients with HIV, because initially there was the fear of how is that going to be transmitted? If I come close enough, is that a risk factor for me? And I'm sure that deterred individuals from getting close to, or caretakers or providers to get close to patients. And I don't mean just physically. I mean physically. It could also be emotionally, but even physically. And now with all the knowledge that we have, before, individuals probably thought that if they sneezed, you were exposed because of the droplets. So I think more so, and I would like to say that everyone in the healthcare field is educated with HIV.
Well, thank you so much for your time.
Thank you once again for the opportunity.